Mask was foreign, but I'm going to keep it. I know. My 95-year-old mother-in-law made this for me. Is she 95? I think she's 95. She might be 95. I think she's 95, but that she made that. Oh, yes, working 9 to 5. Correct. 95 years young, my mother-in-law. So, to start off, I do want to say, first and foremost, we lost another resident last night to COVID-19. A man in his 60s. Brings our total to 170 people total. To the family, my condolences and prayers go out to you, and to the other 169 families. It's a difficult time we're in to go through this, and even harder when you lose a loved one to this. I also want to give my prayers and condolences to Father Young, who's been an icon. Brendan Lyons just put a story in the Times-Union, and they let us know that Father Young passed away at the age of 90, who has done so much in the community, and I could go on from homeless to treatment for people, over 50 years of treating people. And I used to joke with Father Young, because I grew up in South End, and I go, Father, you never got me. I said I was too quick for you, and he grabbed me. He goes, you're not quick anymore. I said, yes, I know, I'm very slow nowadays. But he was a good priest, done so much good for the community, and he's going to be missed dearly, not just to the Catholic Church, but to the people of the South End, and to the people that he's helped with homeless problems, addiction, and I could go on. All the programs he put in place. It's a great story. You should go online and look at it. And this champion he did up at the state capitol, champion for programs and money, and holding senators and assembly members accountable. And whether you wanted to get behind a program or not, when you got done with Father Young, you ended up doing it. So again, my prayers and love go out to Father Young and his family, and to the church for such a loss of a great priest that did extraordinary things. Before I even start the press conference, I was talking yesterday about the stimulus package coming from the federal government, and I commend Chuck Schumer and his team for everything that they're doing. I will say this, please, everyone go out there and make it known. Things are changing. Yesterday was looking so good. I have a call at 1400 today with NISAC to talk about the stimulus package, but we're in trouble again. And here's some of the questions I got hit with. They go, well, you didn't lay anyone off. You had this going on, that going on. And I said, whoa, I offered 72 people early incentive to retire. It was actually 120 people applied. I could only allow 72 to go leave the budget. We're borrowing money for next year to the tune of $40 million, to help offset revenue losses. We took $8 million out of our reserves, and one of the things I quickly done early on was to do the hiring committee back in April to slow down our hiring process. So there's a lot of steps we put into place, and I plan for a rainy day. So yes, we do have shortfalls in our budget from the COVID-19 and other issues, sales tax, and I could go on and on. So I had to paint that picture to the government that basically, yes, it looks good, but the reality is this, I couldn't negotiate the 2% with the unions because it was in place. I ran out of time. I have to deliver my budget by the 10th of October, and the legislature let me go a couple of days late, but I had to get it on time. I actually got it on time because of the holiday. It gave me an extra 3 days. But the reality is this. We need Mitch McConnell. We need the Senate to do what's right for the people. And it's not just about Albany County. It's about the towns, cities, and villages. It's about small businesses. We need that money. So please, by all means, Senator Schumer, I commend you. Continue to do the great job you're doing for us here in New York State, and not just being a leader in New York State, but across the country. But we need this bailout just as much as everyone else does. And I know the state has a $16 billion hole, but we all have our own issues, and there's shortfalls on a lot of revenue and money. But again, please, just to Senator McConnell and to the Republicans, we need it. We need it. We did what we need to do short term to get through the next couple months, get through the holidays. I'm hoping I never got to get to the point where I have to lay off workers, but we could be there within 4 or 5 months. And I'm not trying to scare the workforce, but they know this. I've talked to the unions. We put our letters in place if we have to do layoffs, or we have to look at programs that are going to be scaled back. It's going to happen. Right now, we brace enough to get through this. but we do need the support going forward. So I just wanted to put that out there. So as of today, there's 7,105 positive cases of COVID-19 in Albany County. 2,306 people are currently under mandatory quarantine. We have 186 positive cases overnight. Of the new positive cases, we know 23 had close contact to a positive case, 14 are healthcare workers, and 1 reported traveling out of state. 148 don't have a clear source of infection. And over the last 5 days, the average is 163.8 new positive cases each day. Yesterday, it was 163.6. As of today, 26,855 people now have completed quarantine. 5,786 tested positive for the virus and have recovered. That's an increase of 136 recoveries since yesterday, which is good. There are currently 94 people hospitalized with the virus. 94. The highest was 96. Yesterday, we were at 88. We had 16 new hospitalizations overnight, but with people leaving and coming in, we remained at 94. What really bothered us last night as we were going through all the data was the 19 patients currently in the ICU, up from 14 yesterday. And sadly, that's the highest we've ever been since COVID-19 hit us 9 months ago almost. So the number, I think, was 16 was the highest. Now we're at 19. So something that we have to watch going forward. So far in December, we've had a total of 103 new hospitalizations. That's roughly 11 new hospitalizations each day this month. We saw an 8-day upward trend break over this weekend. We actually saw our hospitalizations come down on Saturday and Sunday. Now we're seeing them go back up for whatever reason. So one of the reasons it took me a little time to get down here is that last night, as we were discussing this, is bringing a health expert in that deals with this because, and I'll get into the matrix, but the health expert can come in tomorrow and talk about the hospitalizations, who handles this type of stuff, ICU beds, care of these patients, and where we're looking in not just in Albany County, but the capital region, because we're in this together. Because we're currently not in the yellow micro cluster zone or micro cluster zones. I know that's a question everyone keeps inquiring about. We're still waiting on guidance from the governor's office, but until we get that, and again, it's changed based on the hospitals and everything else, I thought no better time to bring someone in than the expert that deals with this in the hospital situation. So we will have that person here tomorrow morning to talk about all this, to see where we're at with hospital beds and staffing and everything that the governor has put out, what this is going to be based on. So please, remember to keep that in mind. And we don't pretend, we just deliver what we are being told, and I get it out to the people. Some of the other questions we continue to get is the infection rate versus people's hospitalization versus recovery. I will say to the gentleman who keeps asking them questions on Facebook, look, we just put the data out there. We take it from the CDC. I know it went from 14 days to 10. We're waiting for the governor to change that. If the state DOH is going to go to the 10-day policy, I had a president of one of the universities ask that question because it forced another quarantine that they really didn't need to do. But based on the guidance, it hasn't changed. Nothing's changed until we get that change order or whatever the situation it is. We will put that information out there timely, or DOH will from the state. And again, I have said this. Things change constantly, every second, every hour, and that's why I actually brought up the 1,420 minutes in a day, because things do change throughout the day, and we need to adjust, and we need to adapt to that situation that we're faced with. So as we figure out what we're doing going forward, we'll let you know, and we'll continue to put stuff out there as we get it to change travel and everything else. We are setting up more testing sites. Hopefully I'll have that announced next week. We're looking to make testing more easy, more available. I have to show you the testing I did on Sunday with Phil Calderon from the airport and to Jim Alatras and the staff. It was great. I mean, just taking that little swab and swabbing it in your mouth and getting it tested within 48 hours, I got notified via email, negative. But it wasn't up your nose. It wasn't making you feel uncomfortable. It was. I got to tell you, it was a lot easier to be done, and there was no pain involved. Not that there's pain, but it's not comfortable when you get a swab stuck up your nose, and they're swiping it around. So we're going to look at more of them testing, more of a partnership with them to get out, so we can get more people tested that want to get tested quickly, other than people traveling the airport. So we're working on a variety of things that we're going to get out to the community, and hopefully get more people tested. So our rates, we get more negative, and our rates come down, and right now our percentage rate's too high. But I do want to put a challenge out there. I know nursing homes have been a topic of issues for a lot of people. I know the Senate and Assembly have a bill that they want caretakers to come in. I will tell you this, I don't know what's right, what's wrong. Do we let people in, don't let people out? We have workers that have to get tested. We're getting tested twice a week, now once a week. It's not easy for them. For us to keep the infection rate the way it is, I don't even want to talk about it because I don't want to jinx myself. But I will say this, they're doing a great job at our nursing home, Shaker Place, and they're giving these people the love and care that they need. And I get it, people want to see their moms, their dads, their sisters, their brothers, their lovers, whoever it might be, they want to see them. But we're trying to do everything to keep the COVID-19 out, to do everything in our power not to have them get sick. And I got to tell you, regardless, and I know people like to hear when they have underlying health issues. Well, they had underlying health issues. They were in a nursing home. It's not good. I didn't want to report we lost 15 people in 9 months to this stuff, and I don't want to have any more people lost at our nursing home, or any nursing home, or any resident in this county. So be patient with the nursing home. It's easy for me to say not having someone in there, but I get the phone calls and I talk to people that want to hug and love their family members. You're protecting them. And you got FaceTime now, and you got Zoom, and you got everything that you can do now to still see them without physically putting them at risk. But I will put a challenge out to the school-age kids that are still in school, or the ones virtually that are virtually at home. Can we bring some joy to our residents, not just in Albany County, to all the nursing homes in Albany County, but our nursing home, and we'll put it up, that to send virtual cards for Christmas, Hanukkah, Kwanzaa. Please, whatever you want to write and put out there, email it to us. We can do it virtual for them. We can display it through the nursing home, and let these residents know there's people out there thinking of them. So please, take the time to do this. Kids, I know you're home. I know you're on Zoom at school. You have time to do this. You have time to do a card. So please take the time and take a moment to do an e-card with your child, and we can send it to Shaker Place and at Albany County Kids Care at albanycounty.gov, and we'll get it to them, and it's going to put a smile on their face. And not just them, it's going to put a smile on the worker's face. So please help me put a smile on a senior that hasn't had the opportunity to embrace a loved one in a long time, and I appreciate it. Also want the residents to remind you the Times Union Center is going to be Monday and Friday. Today we have Ward of Elite Dome that we're doing. I know the appointments are full. I know I got a few people yelled at me because they want to get in. Listen, they fill up, and Whitney Young controls that. Please call Whitney Young at 518-465-4771. And again, if you don't have insurance, we pay for it. If you go to UAlbany, it's free. You go anywhere else, yes, you're going to get paid for the test. You're going to pay for the test, or a co-payment if you go to a doctor's office, whatever your co-payment is. So again, please go out and get tested. Go to our Albany County website at albanycounty.com. It shows the listing of every place you can go to. It's on there. I know I continue to get that question of where you can go. It's on there. Take the time. It takes you 3 minutes, and you can click on there very quickly. You can go through all the different sites to find out where they're all at and the numbers for information of what you're looking for. And again, UAlbany, Price Chopper, CVS, Priority One, Walgreens, and plenty others are all involved in more, but we do need more testing. There's smaller counties than us doing more testing than we are. We need to get people to buy into testing. We need to get people to understand this. Please wear your mask. Cough into your arm, clean your hands, stay 6 feet apart. It's going to be a rough month, It's going to be a rough month coming up and in January, and according to the CDC and all the health experts. Not me. I'm not kill the messenger. I know people are getting mad when I say this. A lot of people doing the right thing, and thank you for doing the right thing, and thank you for continuing to do the right thing. That's what keeps us down with spreading this. But if I can tell you now, I have seen personally groups of people that it's been like that domino effect, that one after a person got it, you know, the in-laws got it, the grandmother got it, then the brother-in-law got it, and then it just started spreading. Then I watched another guy get it who goes, oh, I was in contact with somebody, still went out. And now he has it. Now you got to, it affects all these people. So just don't think about yourself. Because I was saying this, gentlemen, like, you're like a super spreader. I mean, seriously, stay home. What are you doing? You know, it's not a laughing matter. If you know you're in contact with somebody, staying in your house for 14 days isn't the end of the world. Do a project you want to do. Paint a wall. Do something. You know, you don't have to feel like you're being, you know, isolated in a room and you're locked in there for 14 days. You know, call your friends, have them drop food off to you, make them pay for it, you know, and there you go. There's your challenge. Say, hey, I want a steak sandwich from someplace. Help the local restaurants with takeout and have people pick up food for you and feel sorry for you. I mean, seriously, these are things we can do together. And if you know people that need help, we set it up with the National Guard before to get food to people. I know everyone's doing a great job, and we can get people food that need it. These are dark times coming, and I'm hoping with these holidays upon us that it doesn't set us back more than it already has. For mental health, please, adults with children that need it, call our number. It's 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. And I should have Karen Ziegler come in and talk about everything going on that avenue. It's been a while to address it, because though we're dealing with this COVID-19, we have so many other issues that it is having a ramification with other areas. And there's one thing I talked to Steve McLaughlin about and other county executives, Newhouse and Mark Poloncarz. I could just go through the whole list. That we're seeing other services, not like in DSS, SNAP, HEAP. People are applying for more heating assistance, more food, housing. More people are starting to get, you know, losing their housing now than ever before, even though we don't, you know, the governor, and rightfully so, put no rent out there for a while to stop people getting evicted through this. But we're still seeing that. We're seeing that uptick. So we need to address that as we go forward. Our 211 with United Way, thank you. New York State hotline, as always. And again, you know, look, we're going to try to decide how we're going to do this. I wasn't planning on doing a press conference today, but when I saw the ICU beds and that stuff taken off, these are things we have to talk about. And I said this to my staff, getting numb to 186 people, I'm like, all right, it's 106. Even we are starting to get a little numb to it, because, all right, we know the number's going to be high. Yesterday it was at 205, 106 today. What's it going to be tomorrow? But I will have the health expert in here to discuss that as we move forward in these next few weeks. Please stay safe and healthy. Any questions?
I don't know if you heard about this or not, but yesterday the governor's office announced that Larry's Tavern in Watervliet had their liquor license suspended because of some COVID compliance issues. Was that an area that was reported as a problem place to you previously, and has that been involved in any contact tracing?
Yeah, I mean, it goes through Paws, New York, and it comes to our office first, and then it goes up to the governor's. And it's something that we talked about, Mayor Pat Cicelli in the past, other problems. Again, we didn't want to go in and find people. We know they're having a difficult time, but you got to do the right thing, and they weren't, unfortunately.
But were positive cases linked to that location? That's probably a better question for Dr. Whalen, but as far as you know.
As far as I know, no. I know another bar there was, but to that one I did not know. But we'll find out for you. We'll get back to you with that.
Does the SLA contact the county before they suspend liquor licenses for warnings or anything of that sort?
No, we read about it just like you do. When it gets released, fines, all that stuff. You know, like when I think there's a bar in Del Mar got fined $4,000. We find out about it. Either A, the owner's calling us, yelling at us, or B, we read about it.
Is tomorrow's official who will be telling us about hospital capacity from Albany Med?
I'll let you know tonight.
That's it for me.
Any other questions? Thank you, everyone. I didn't even drink my water today, but I'll take it with me.